What I'm aiming to do is to go through some concepts in terms of overall concepts of helping to support people with cancers, but I'm doing it with a particular emphasis on prostate cancer, because to try and do it for every cancer would just take too long. And so there'll be a certain emphasis towards prostate cancer. So let's get going. We know cancer is a very big deal worldwide. It's probably the second cause of death, depending on which country you are in. And we know that it affects people with different characteristics, which I'm going to go on to talk about in a moment. If we look at the incidence of which types, as you can see, lung, breast, and colon are probably the biggest three, although prostate's not far behind. Prostate cancer incidence, as with the incidence of many other cancers, has been slowly increasing over the last 40 years. And you can see this as it coming up, depending on which country you're looking at. It also brings up the old kind of discussion between, is cancer about the seed, meaning the cells themselves and how they behave, the genetics, etc., or is it more about the soil? And I think that discussion has changed over time. This is Stephen Paget, who is a surgeon who basically brought out the first idea that the metastases from cancer may have a lot more to do with the soil than the seeds themselves. And this has gone on to be a much bigger subject as time has gone by. And we've been looking much more at the soil, the milieu, the environment that the cells grow in. If we look at genes in cancer, well, genes really make up a much smaller proportion of what is likely to cause cancer. So you can see here 5 to 10%, depending on which studies you look at, whereas a great majority relates to the environment. If we particularly look at the genes and say, okay, which ones? So this is simply saying that in certain cancers, you have certain genetic tendencies that make it more likely to have that cancer, but they still play a small part overall for most cancers. I can't get away from Larson. This is saying the real reasons dinosaurs became extinct. Well, we do need to look at our lifestyle habits. And of course, right at the very top in terms of cancer-related exposures is tobacco. Diet probably comes in second, and we'll talk more about that. After that, overweight and various other components, again, we'll talk more about as we go along. Diet, you're going to get different figures, but the idea overall, probably around a third, at least, of cancer causation or triggering, I would say. It may relate to diet. In different cancers, different amounts. So colorectal in particular seems to have a large amount, and we'll talk a little bit about some of those aspects. Same with prostate. This is a lovely comment put out by the WHO. It's saying that a large number of lives could be saved annually simply by increasing our amount of fruit and veggie intake. And we know that the opposite is true, that if people have low amounts, that they get far more cancers, and in particular GI cancers, and as well as ischemic heart disease and strokes related to low intake. This is a simple graph showing that on the left-hand axis, your chance of mortality and the number of servings of fruit and veggie you have. And as you have more servings, your mortality ratio goes down. And quite straightforward. So once you get down to 4 or 5 servings, it tends to level off. If you look at which ones, well, obviously veggies and fruit, the top 2 graphs, but the both work better together. Which veggies? Well, yeah, take your choice in a sense, but certainly the cruciferous veggies have been shown to decrease the risk of prostate cancer, or at least certainly in observational studies. Talking a few more particular nutrients, this is for prostate again. So lycopene, which comes largely from tomatoes and in fact cooked tomatoes or dried tomatoes, has a huge antioxidant factor, and I'm going to talk, we'll go on to the next slide, and that also shows that how it works. But the fourth point showing that it affects other tumors as well. There are various studies in terms of using it in prostate cancer to prevent or treat. These ones are showing that over on the right-hand side, you probably can't read it easily, but basically that the PSA level certainly can be affected in a positive way. Omega-3 and omega-6, just to briefly mention them, on the right-hand side is omega-3, which is largely from fish, and on the left, omega-6, of which a lot of the Western diet in terms of the junk diet comes from. And we've known this for a long time that the omega-3 tends to favor an anti-inflammatory response versus the omega-6 causing an inflammatory response. These are other risk factors. Low selenium has certainly been shown in a raft of studies and a meta-analysis to relate to the prostate risk. There was even a study done in China where they gave a town of 30,000 people selenium with no need for permission or getting ethical approval, and another 30,000 in a different town were compared to, and it showed that those who were given selenium ended up having less cancers overall. Another Larson cartoon. Impolite as they were, the other bears could never help staring at Larry's enormous deer gut. Now, this is basically to bring us on the idea of what about animal foods? What about meat? So there's a lot of literature now. Some of it is fairly low level proof, but two of the chemicals that have been looked at, and I think Cindy mentioned these, heterocyclic amines and polycyclic aromatic hydrocarbons are thought to be part of what is causing the problem here. We know that they're formed when heat is applied to meat, and that there is potential for them to cause, to be oncogenic, basically. There have been a number of studies to say, okay, is there a direct link or not? Certainly in animal studies, it looks like those chemicals may be related. In human ones, there's not been a complete direct link between those chemicals, but there has certainly between the use of meats, and particularly cooked meats and barbecued meats. So we know that they are related to both colorectal and prostate cancer. There are various ways to reduce those chemicals, and I've just listed them there. Basically, it's the heat largely, and the flame and scorching that you're trying to avoid. Although it's interesting, if the meat is well marinated, it changes the chemical composition at the surface, and that reduces those chemicals. Back to prostates, here he's just saying, and if you'll kindly relax your sphincter, I'll be happy to write you a prescription for that inflamed prostate. And what we do know about prostates, that inflammation, it does appear to be related to the incidence of prostate cancer. And that the use of NSAIDs epidemiologically causes less prostate, well, is related to less prostate cancers. The causative link isn't necessarily there. Certain bacteria may also cause inflammation, including those from our mouth and our skin, certainly in animal models. We know there are a number of carcinogens, and again, Damien touched on these. The more you get into high-level carcinogens, the more cancers you get. So the carcinogen category 1 is the worst one. And we know air pollution is a part of this, and it's not simply the chemicals, but the actual particulate matter itself, which can be linked to that, and particularly to both bladder and prostate cancer. Indoor dust and indoor chemicals are a major part of our polluted environment. And I won't go through them all, but phthalates, the plastics, various other things, the anti-stick, the anti-fire chemicals, and in particular bisphenol A, which has been known in a lot of our plastic containers. And again, Damien mentioned those. They appear to have quite an effect on various illnesses, including probably breast cancer and prostate cancer. Interesting enough, diesel engine exhaust also related to some cancers, and I put those down there at the bottom where it appears to be related to prostate cancer as well. And we know ionizing radiation has a relation to cancer, and we know particularly prostate cancer can be affected. Stress, interestingly enough, this is one that's been argued about some time. And certainly when they look at the psychological profiles, it seems that anxiety may be part of those who have prostate, but also those who've been on beta blockers tend to get a lower incidence of prostate cancer, which is interesting. So here we are. This is a combined one for prostate cancer, the likely risk factors, and of course there are a huge number from diet through to the environment, through to probably psychosocial. So moving on to an integrative approach to cancer management, again with an emphasis on prostate cancer. These have been talked about already: diet, lifestyle, and psychosocial. And this is pretty well my own list that I go through with patients who want to look at an integrative approach. So starting off with what I call the base layer, which is the diet and lifestyle. Then the next layer up being looking at very specific nutrients and certain other substances. There is another layer above that, which is quite controversial, called off-label medications, and I'll talk briefly about some of those. And then, as Damien's been talking about, injectables, particularly intravenous vitamin C. And then there are other specific therapies, which I won't spend long on, that again, Damien touched on. So food is a medicine, very much so. It's not just Hippocrates that said that, it's been said all the way through over the last few millennia. Here's a Mediterranean diet done in a New Zealand study. And here looking at the effects on DNA damage and showing that if you go on the right style of diet, like the Mediterranean one, you get less damage. Vitamin D deficiency is quite common in cancers, and we realize that there are some mechanisms whereby that may be important. Lycopene, I've already mentioned. As I said, it tends to come from cooked tomatoes, dried tomatoes, most tomato soup, tomato paste, but tomatoes generally, and various other orange vegetables. This is some of its pathways when you're looking at trying to initiate, promote, and progress a cancer, or how that happens rather. There are various components, and we see that lycopene seems to come in at this point in terms of trying to affect apoptosis, cell cycle, and growth factors. If you want to get really into the chemistry, there it is. I'm not going to go there, but there's been a lot of work done on that. Again, some of the studies I mentioned about PSA effects. Another fruit which I particularly enjoy, pomegranate. There is evidence that it helps prevent doubling times in prostate cancer, and in a particular subset of patients with prostate cancer, it had quite a definite effect. The manganese superoxide dismutase enzyme is one of your main antioxidant enzymes. Curcumin, a wonderful herb in terms of its potential anti-cancer properties, and has been looked at in many different cancer types, but here I'm looking at prostate ones. And there's some good evidence that it works on various components of how the cancers propagate themselves. What do we have a problem with a lot of studies in terms of nutrition and herbs is there aren't the large randomized controlled trials to see if they are effective in treatment. There are some small ones, but not large ones. So a lot of this is from epidemiology and animal experiments. This is telling you curcumin. You see at the top here, it has a massive number of effects, partly through NF-kappa B, but various other ways. So angiogenesis, proliferation, apoptosis, and so on. This is in a mouse model. Soy isoflavones, so this is from soy. There's some evidence that the intake is related to prostate cancer. So the more people take, the less prostate cancer. And a pilot study looked at that and showed that those people with hormone-dependent looking prostate cancer, there was a decrease in the rise of PSA. Quercetin, another herb, well, it's a component of plants. It tends to come from the skin of plants, particularly apples, but people often take it in a capsule form. And there are various trials on that. It appears to reduce the incidence of prostate cancer. We know some of the actual mechanisms it may be helpful in terms of how it modulates various reactive species and some of the pathways in cancer. This is an interesting study because what it's showing is real life. So it's looking at 3 different substances: curcumin, another one called ursolic acid, and resveratrol. Those of you who like Pinot Noir will know what resveratrol is. And what it's showing is the top graph is the placebo group, the control group. And as you use those different herbal nutrients, you get an effect in terms of tumor volume. But as you combine them, you get an additional effect. So in a clinical environment, we obviously tend to combine things to get that synergistic process happening. This is one of those where they basically took a mix of polyphenols, and including pomegranate, green tea, broccoli, and turmeric, which is where curcumin comes from. And they found that the PSA rise was considerably reduced. There are various other herbs and phytonutrients that we can use, and this is just a list of a few of them. And there are a number of research articles on all of these. So certainly in animal studies, cell studies, and occasionally in human studies. Another nutrient I'd like to mention is melatonin. We tend to think of melatonin as something to help us get to sleep, which of course it is. But there's evidence that the melatonin ratio may be related to prostate cancer incidence. And we know that if you use higher doses, more of a pharmacological dose of melatonin, there are ways that it may inhibit prostate cancer growth, and in fact, in many other cancers. The melatonin seemed to improve survival in prostate cancer after they'd had combined hormone and radiation treatment. And if you think, how does it work? Well, they now realize there's probably at least 8 different mechanisms where it may be partly effective in terms of helping slow down or even possibly prevent cancers, but certainly help treat. Again, there aren't large trials to show that in humans, so these things are yet to be done. Off-label drugs, again, quite controversial, and I'm not saying there's a lot of proof for this. I'm saying that these things are being looked at a lot more. One of the most common ones to be used is metformin, which we all know from using it in mild diabetes. And there are numerous ways that it affects cancers. Very little to do with sugar, by the way. It's much more to do with these other cancer pathways. And that a meta-analysis looking at the mortality benefit in prostate cancer was quite helpful. And one of the reasons they think is that it may actually help target stem cells, which are obviously what are largely involved in metastases. Statins, strangely enough, have been used for cancers, and these are observational studies. Those people who have used statins tend to get less cancer, and this includes prostate. There are some ideas of how it may happen in a chemical sense. This is another unusual drug. We think of this obviously for treating worms, but there are a number of ways that mebendazole may be helpful at affecting tumors, and it's certainly been used in a mouse model of prostate cancer. Doxycycline, a well-known antibiotic, it's got a number of other effects which we know about, and in terms of cell metabolism in cancers, there are some reasons why it may help. And certainly at a cellular level and animal models, it seems to be helpful. Celecoxib, just one of the anti-inflammatories, a COX-2 specific one. There are some low-level proof of that. This is a study where the PSA velocity was less in the celecoxib group, so there's some evidence possibly there related to doubling time. I'm bringing this up, the so-called COC, which is the Care Oncology Clinic in UK, and they've published quite a lot about how some of these off-label drugs may be of benefit, and this is just a composite picture of how they can affect cancer cells potentially. Again, we need the studies to show clinically they are relevant, but statins, metformin, mebendazole, doxycycline, at different parts in the cycle theoretically have an effect. As I said, yet to be proven clinically. Various other off-label drugs are out there and are being looked at, and I've put them there. And again, for some of these, the likely mechanism has been already shown. This is a book that a number of patients will have read if they're interested in this sort of approach, and hence it's good to have had a look at. This is Jane McClellan's book, and she has this so-called metro map, which is the idea of a cancer cell in the middle and its forms of metabolism. It's there's a lot of extrapolation of ideas here, so I can't say these are clinically proven, but it gives an idea of how some of these things may fit together. Again, the proof is yet to be shown. Mistletoe, another well-known substance, particularly in Europe, where it's used in large amounts. There are studies showing that it may increase quality of life in cancer patients, may help them deal with chemotherapy. There is some evidence that it may increase survival, certainly in animal experiments. And we know some of the likely compounds which are effective. In Europe, they tend to use it in some cases alongside chemotherapy and so on. Thankfully, we've had a good talk on this by Damien. So intravenous vitamin C, we know some of the reasons. I'm showing here more to do with prostate cancer. So there are some evidence there that it may have some usefulness, certainly in animal models and in humans in quality of life. We know some of the mechanism. I won't go into this in terms of production of hydrogen peroxide, whereas normal cells are protected by the enzyme catalase. But in fact, we now think from a large amount of research, including Professor Marguerite Visser's in Canterbury, that there are many different mechanisms, including change in gene transcription and so on. Other potential therapies, again, Damien touched on these. I'm not going to go into them in any extent. Other than to mention that one I'm interested in, because I have an interest in lasers, is something called sonophotodynamic therapy. And in various parts of the world now, they're introducing lasers through a catheter for men with prostate cancer. And they're showing that if you sensitize the cancer with certain, usually herbal or chemical substances, and use the right frequency laser, you can get a therapeutic effect on those cancer cells. And just to bring up a particular meta-analysis for prostate cancer, they've shown in 14 studies that they had a negative biopsy rate in over half of them after the treatment. It decreased PSA and very low side effect rate. But again, as often said, we need more high quality RCTs. Once again, Damien's mentioned this, mind-body interventions. There are many things, and I think there is a lot of importance in these. There's a little bit of proof to some of them, but I won't go into it. A number of places around the world offer these. This is two particular friends of mine that do it in Australia, Patria King and Ian Gawler. And to just summarize, because I know we're getting close to the end of this session, again, Damien and others have gone through some of these things. Diet, very important. High veggies and fruit, minimizing meat, and to some extent the Mediterranean, but of course there are very specialized diets which I haven't gone into today, like the ketogenic and so on. We're trying to improve the environment to make it a less risky one in terms of cancer production, the usual lifestyle things which are very important, and then the specific nutrients and natural substances. I've listed a few there, just as options to consider, particularly for prostate cancer in this case. And of the specialized ones, again, we've been through these and I won't go over them any further. So thank you very much. That's a rather brief whistle-stop tour through some ideas on helping support people with cancer therapies. And as I mentioned, a lot of patients, certainly that I see, come in already equipped with a lot of information. Some of it may be a bit spurious, and it's important to have a wider view of what's out there, I think, in order to be able to help direct them in a useful and safe way. Thank you very much.